So I'm delighted to be here at the workshop, and I think it's a great opportunity for many reasons. One of the points that I see is that the world has changed, and we see this in terms of how mortality in children has been reducing, but there are still some areas where mortality and the morbidity and the diseases that children suffer are still just not being resolved. And a lot of this focuses around the nutrition that they have available to them and the impact that that has on their immunity and their ability to fight infections. So WHO and other agencies have an important role to advocate and to lead things at a global level, and we have seen now the shift to things like the Sustainable Development Goals, which is a really important forward-looking perspective. We also have what's referred to as the UN Secretary General's strategy for women, children and adolescent health, and I love it because it talks about still that unfinished agenda of children surviving, but it also puts out there this other word about thriving, that we want children to thrive and for women to thrive and for adolescents to thrive and not only survive, and those are part of the same continuum. But as much as those are really great and important things that help us on our way, the real thing that we should be judged by is what is the impact in country. It's very nice to have these frameworks and it's nice to have them behind us, but if we're not making an impact in country, then all these things really mean nothing. And in that sense, this meeting is very important because it is really trying to get to the detail of implementation on the ground and dealing with the real life barriers and challenges. So there've been two things that I have particularly picked up from the meeting. And one is the first: how do ministries of health deal with the major system type constraints to deliver the care at the time when there is great competition for limited resources? And are there innovative ways that we can help with this? Is there ways in which that communities can be empowered to take more responsibility and benefit from the opportunities of doing things for themselves? But that can still be facilitated, and importantly facilitated, by ministries of health. And the second big challenge that I see is having the evidence to inform guidelines. At the moment we are still struggling in many ways because we don't have high quality evidence for these guidelines. So from a WHO perspective and from the type of work I'm involved with, this evidence is pivotal. But it is really the support to the ministries that's where the real work happens. And so in that sense, I'm certainly delighted to be here and partnering with the colleagues from USAID and from UNICEF. But even more importantly and more especially, to be sitting down with colleagues in the ministries of health who have that primary responsibility to deliver. And not just to deliver, but also to find solutions to the really difficult barriers that we find on an everyday basis.